Vicks Vapodrops 1.7 mg not applicable is used to temporarily relieve symptoms such as sore throat, throat irritation, or cough caused by a cold. It works by providing a cooling sensation and increasing saliva in the mouth. It is important to check the ingredients on the label, as the manufacturer may have changed them. Additionally, products with similar names may contain different ingredients meant for different purposes. The recommended dosage for adults and children over 12 years old is 1 drop every 2 hours, with a maximum of 8 drops in 24 hours. It is best to take this medication as needed, and it can be taken at any time of the day. When using Vicks Vapodrops 1.7 mg not applicable, make sure to carefully read and follow the directions on the package. If you have any questions, it's best to consult your pharmacist. Allow the lozenge to dissolve slowly in your mouth and then swallow the liquid that has dissolved along with your saliva. Do not chew or swallow it whole. Typically, this product is used every 2 hours as needed. Make sure to follow your doctor's instructions on how to use it if it has been directed by your doctor. Do not increase your dose or use it more often or for longer than directed. If you have a severe sore throat that lasts more than 2 days, or a cough that lasts more than 7 days or keeps coming back, or if you experience symptoms along with a fever, headache, rash, swelling, nausea, or vomiting, it's important to inform your doctor promptly. If sore throat or cough symptoms do not improve or last more than 7 days, it's essential to see your doctor or dentist promptly. These could be signs of a serious condition. If you think you may have a serious medical problem, seek medical help right away. If you experience numbness in your mouth or throat while using Vicks Vapodrops 1.7 mg, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. While many people do not experience serious side effects when using Vicks Vapodrops 1.7 mg, it's important to seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. There may be additional side effects that are not included in this list. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Vicks Vapodrops 1.7 mg not applicable, make sure to inform your doctor or pharmacist if you are allergic to menthol or have any other allergies. It's important to discuss any inactive ingredients that may cause allergic reactions or other problems. Also, inform your doctor or pharmacist about your medical history, especially if you have breathing problems such as asthma or emphysema, or if you have a cough with a lot of mucus. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar and/or aspartame, use caution and consult your doctor or pharmacist before using this product. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the use of this product with your doctor or pharmacist. For breastfeeding mothers, it's advisable to consult your doctor before using this product, as menthol passes into breast milk in small amounts. When taking Vicks Vapodrops 1.7 mg, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share this list with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. Always consult with your healthcare professional before making any changes to your medication regimen. If someone has taken too much Vicks Vapodrops and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to your provincial poison control center. It's crucial to act quickly in these situations to ensure the person receives the necessary treatment. Make sure to keep up with your regular medical checkups and appointments with your healthcare provider. This will help monitor your progress and ensure that the medication is working effectively for you. This product is not applicable for use. It does not have any specific uses or indications. It is not intended to treat any specific condition or symptom. Please consult with a healthcare professional for appropriate treatment options. When it comes to storing Vicks Vapodrops 1.7 megagrams and not applicable, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that's not the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, always follow the proper guidelines for disposing of medications to keep everyone safe. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.